When we ring in 2022 in just a few hours, surprise medical bills are one of the things we'll be able to leave behind. That is the goal of what's known as the No Surprises Act, which does take effect tomorrow, January 1. The law protects patients who unknowingly receive care from an out-of-network provider from being billed for that service. It's a common situation, actually, during emergencies or even elective procedures when something unexpected happens. Joining us live from Washington, D.C. is Patricia Kelmar, Healthcare Campaign Director, U.S. Public Interest Research Group. Thanks so much for your time and for being with us on this New Year's Eve. This really is an important law that's going to impact a lot of people in a good way. So I want to get into it a little bit. So talk about exactly, in layman's terms, what this bill does and whom it protects.
So we're very familiar with the concept of surprise medical bills. About 1 in 5 Americans experience a surprise medical bill if they've received emergency room care or they've had surgery. And those are the kinds of bills that come from out-of-network providers that you didn't choose. There was no way to avoid them. Certainly in an emergency room, you just get taken to the closest emergency room. And then in an in-network hospital, sometimes we get out-of-network bills from anesthesiologists or assistant surgeons, folks we didn't even know were going to be treating us and we didn't even pick. So those out-of-network bills can be a lot of money, but the new law going into effect on January 1 will protect us from those bills by banning them. You'll only be responsible for your regular in-network costs.
So then, and that's only a welcome news to a lot of people, nothing worse than having some kind of medical issue and then a few weeks later some bill comes and you're like, what in the world is this? So it's certainly good news. But then who, now that this law goes into effect tomorrow, who does indeed pick up that bill? Who's left to fight over the tab, basically?
Right. So the insurance company is left with this out-of-network charge. We haven't been charged that added cost. And so we've just paid our deductible, our coinsurance, and that kind of thing. So now there's the out-of-network provider who wants to be paid, and they are charging whatever they want. They're not obligated under a contract to charge something specific. So they have 30 days between the provider and our insurance company to negotiate what is an appropriate cost. If after that 30 days they're not happy with the final settlement of the bill, the provider is allowed to go to an arbitration system that's been set up under the law. And that arbitration system is good news for consumers as well, because insured Americans have been paying these out-of-network charges through our higher premiums, about $40 billion extra every year. So this new arbitration system will set up a way for providers to be paid what an average cost or average charge would be in that community. And it will bring it back to a market price.
Wow, $40 billion. That's extremely telling. And you can't blame folks for being confused because sometimes there are, out-of-network providers who are working in-network facilities. So you don't know who you're getting and if they're part of the network. And when you're having a medical crisis, that's really not your first priority, is who works for whom. So it does seem like a bill that's looking out for the little guy and those who don't read the fine print on everything or wouldn't be in a position to read it. So in layman's terms, again, I go to the ER for one reason or another. How exactly am I protected, even if it's a routine procedure?
So in an emergency room, you are protected whether you're brought to an in or out-of-network emergency facility, whether or not that emergency room doctor is out-of-network. It doesn't matter. You'll still pay what you would normally pay as if it was an in-network service. So you'd still be obligated for your co-pays, co-insurance, your deductible. But that would be it. You wouldn't see that surprise bill coming in weeks later from an out-of-network doctor. In the planned situation where you're planning your care, you should do what we've been doing all along, is picking our in-network facility, picking our in-network doctor. But the good news is we won't be seeing those surprise out-of-network charges from radiologists or assistant surgeons or even lab services at our own in-network facility. We'll be protected from that. But if I can tell you one recommendation, there are certain doctors that have the ability to offer you a way to waive your rights and give up those protections and see them as an out-of-network provider. So this is a surprise billing protection form is what it's called. But the reality is it's a form that is requiring you to pay an out-of-network provider whatever they want to charge, and you are financially obligated. So we recommend no one sign that form unless they are really sure they're willing to take on the extra costs and that they really want that particular provider. The good news is that form will also have a list of providers who are in network. So don't take on that added cost. Just ask for the providers who are in your network who can provide the exact same services, and save yourself some money, and know that you won't be surprised at the end of the month when you see your medical bills.
Such great advice. And at the end of the day, most of us take the in-network provider to limit our financial exposure for whatever may happen. And it's worth noting this was a bipartisan bill that got through Congress. We can't say that a lot, so we will say it when we can. This was a bipartisan effort and becomes law tomorrow. Patricia Kelmar, Healthcare Campaign Director, U.S. Public Interest Research Group. Thanks so much for your time, and Happy New Year to you and your family.
Thank you. Happy New Year.
Appreciate it.